and welcome back to another episode of There's Danger Here. I'm Leilani, and today we're going to go into Texas. So let's just get started, shall we? Genene Ann was born on July 13th, 1950, in San Antonio, Texas. A baby of the state, she was adopted by Dick and Gladys Jones relatively quickly as one of 4 children the couple had adopted. The couple was wealthy as owners of a nightclub named the Kit Kat Bar. But at some point in Genene's youth, the nightclub began to fail and the property was eventually auctioned off. After that, Dick worked in the billboard industry. Genene was an above average student growing up. She learned quickly how to do new things, picking up piano, baking, and sewing. But she was not at all social. She was described as bossy and aggressive to those in her cohort. She couldn't handle criticism and would lie or manipulate others simply to get her way. Genene was jealous of her older siblings, and as she grew, she fought with them at an increasing rate. As such, she didn't have many, or really any, friends to speak of growing up, except for younger brother Travis. Then, in 1967, when Genene was 16, Travis made a homemade pipe bomb and it exploded, killing him. A year later, Dick was diagnosed with terminal cancer and, after refusing treatment, passed away relatively quickly. Before the new year, he was already gone. The same year, Genene graduated high school, and she married her boyfriend, James or Jimmy Harvey Delaney Jr., after faking a pregnancy. Gladys paid for the wedding and let the young couple move into a trailer on their property. Jimmy dropped out of high school and shortly after getting married was told that the pregnancy was simply a ruse. He stayed, but drank and partied. The two would race Genene's El Camino and fought regularly, and after just a year and a half, James enlisted in the Navy. Genene used this time to have affairs while Jimmy was away. Genene managed to move into an apartment on her own and enrolled in beauty school. And after completion, she went to work as a beautician in a hospital. Jimmy came back after his time in the military and worked as a local mechanic. The couple had their first child, a son, in 1972, after which Genene filed for divorce. But the paperwork was never completed, and they ended up getting back together for a short time. They managed another 2 years before Genene filed for divorce in 1974, and this time went through it. In 1976, Genene had her first daughter. Later the same year, Genene's older brother was diagnosed with stage 4 testicular cancer, passing away shortly after the diagnosis. Despite being adopted, Genene began to perseverate on the idea that she too had cancer. Anytime she was in pain or got a bruise, she went to the hospital. Fears of chemicals in the salon causing cancer ended up driving her away from that career and, very unexpectedly, into nursing. Genene entered into the Licensed Vocational Nurse, or LVN school, which is a year of schooling when compared to the 2 to 4 years that an RN gets. She did well in school just as she did in high school, and she graduated in May of 1977. Her start in the working realm was delayed slightly by pregnancy. It wasn't until September that she actually started working, and at this time, she went to the ICU in San Antonio Methodist Hospital. She lasted there until April 26, 1978, when she was fired. Unlike most cases, this hospital listed a reason for her firing. The hospital reported that she mistreated a patient and made improper decisions in situations she wasn't allowed, likely alluding to the differences in RN and LVN roles within a hospital. Still, she immediately moved on to a smaller hospital and then resigned in October in order to get her own medical procedure done. Next, she moved from there to Bexar County Hospital, and there she worked in the Pediatric Intensive Care Unit, or PICU. Here, she overreacted to the loss of any child, but her IV skills and ability to learn made Genene a favorite to some of her fellow medical professionals, often keeping her safe when she should have been fired. A few examples or when she befriended Pat Belko, a charge on the unit. Pat sent her home during an incident where Genene showed up intoxicated and messed up an infusing IV in a child. Another was Dr. James Robotham, the director of the unit. While coworkers complained about Genene's capabilities, he praised her overtime. It took a long time for Robotham to see the truth. In the meantime, Genene began to believe she was better than her coworkers. She berated other nurses, overstepped with patients, and didn't follow doctors' orders or changed the treatment to what she believed would be better for the patient. This only caused her coworkers to take more notice of her. All eyes ended up on her. After all, she was the loudest person in the unit. Nurses reported any and every error she made, and Genene made many. At this time, she continued to suffer from hypochondria, coming into the hospital for her own supposed ailments. It also appeared that she either had Munchausen by proxy or simply wanted attention, calling and paging doctors for made-up ailments of her own patients. Throughout it all, she continued to make errors at work, including several medication errors in which she changed the doses of medication to what she believed was more appropriate. As a result, she was sent to attend classes on drug administration from the hospital, but she simply never attended them. In her cares, she would become overly attached to certain patients. If they died, she refused to follow procedure. Multiple sources report that she would wash them, swaddle them, and carry them down to the morgue herself, in hysterics every single time this happened. At the time, it was often Genene who would be the one to say these children were going to pass, even if they seemed okay at the time she started saying it. Again, this feels like Munchausen by proxy. Staff noticed, and several attempted to bring it to the attention of the higher-ups, but were often thwarted by Pat Belko and Dr. Robotham. I think it would be pertinent to speak to the murders that were ignored by Belko and Robotham. On February 22nd, 1981, Dolores Rios, who was just under 2 years old, was brought in for dehydration, diarrhea, and fever. She was ordered antibiotics and saline, pretty standard even now, but after Genene came on shift, she administered something, and Deloria went into cardiac arrest and died. On March 21st, 1981, Christopher James Hogita, a 15-month-old that was admitted for pneumonia and diarrhea, died. Christopher's healing was complicated by a congenital heart defect, and after being admitted, was confirmed to have hepatitis. Still, it was a surprise that he went into cardiac arrest when he did. On September 16th, 1981, Rosemary Vega also went into cardiac arrest. Rosemary, the daughter of Rosemary Cantu, a housekeeper in the hospital, was brought in to have a procedure done. Rosemary was admitted for debanding to correct a congenital heart defect. The procedure was completed without complication, and Rosemary was transferred to the PICU to recover. She did well until Genene's shift, when Rosemary suddenly had breathing issues and had to be placed on a respirator. The situation continued to deteriorate when seizures began, corrected when a doctor noted a change in the ventilator's oxygen output, meaning Rosemary wasn't getting enough oxygen. After being corrected, Rosemary once again stabilized. Then Genene came back to work, and Rosemary subsequently had 3 different cardiac emergencies before succumbing to them. Rosemary became witness to Genene killing her daughter without even knowing it. She even stated, quote, "Everything was good. I was sitting by her bed after surgery. Then Genene Jones came in on the afternoon, and that's when it all happened. She walked in with the injection. I saw her and asked what she was doing. What are you going to give her?" The nurse had just left and took all Rosemary's vital signs. She said, "I'm giving her something to help your baby rest." After she walked out, not 2 minutes later, my daughter started getting the code blue, end quote. Next was Jose Antonio Flores, a 16-month-old brought in for fever, vomiting, dehydration, and diarrhea. While in Janine's care on October 10th, 1981, Jose had a rapid decline. He began bleeding excessively from any blood draw and from his IV site. In addition, began having cardiac issues, and once again, this was wildly unexpected with his admission. As such, a brain scan was ordered, and Genene hand carried the child down, during which he went into cardiac arrest and died. Finally, Dr. Robotham seemed to take notice, but his focus was on heparin, an anticoagulant that can prevent blood clots, but when given in too high a dose, causes excessive bleeding and the inability to clot. In all the children in Janine's care, they suffered from bleeding at the time of death. The result was a change in policy on removing heparin. 2 nurses had to sign it out and document where it was being used. Additionally, any children that went into cardiac arrest had their blood tested for heparin levels. For a couple months, this seemed to work. On December 12, 1981, 11-month-old Joshua Sawyer was admitted for severe smoke inhalation after being rescued from an explosion and fire at his family's small rental home. He had shown signs of improvement before arresting twice and dying again under Janine's care. His mother, according to Texas Monthly, Connie Weeks, recalled how, by Joshua's 4th day in the ICU, his seizures stopped and he was breathing without a respirator. A friend had even taken Connie to get a break for a shower, a change of clothes, and a movie at the nearby Galaxy Theater. Quote, "I knew he was doing better," end quote, said Weeks. Then an usher came into the theater and let her know she needed to go back to the ICU. Joshua had suffered the first of a series of unexpected emergencies that led to his ultimate death. After, of course, Genene arrived to care for him. On December 27th, 4-week-old Rolando Santos was admitted for respiratory issues. He was vented and did fine for 3 days, when afterwards he went into cardiac arrest, but was resuscitated successfully. After this, he was sent to get a brain scan, and then on January 1st, Rolando began bleeding profusely after lab work was obtained. His blood pressures began falling and were eventually corrected. He did seem to stabilize for 5 days, when the same thing happened again. This time, the attending, Dr. Ken Copeland, had his blood tested for heparin, and the result came back the presence of it in his bloodstream. Then, on January 10th, it was like deja vu with bleeding and blood pressure again. Again, Dr. Copeland ordered heparin lab levels, and the child resulted with a significant amount of heparin in his system. Here, sources are vague, but it sounds like Dr. Copeland had protamine sulfate available and used it to reverse the effects of heparin. Dr. Copeland ordered a transfer of the child out of the PICU. When he found that the child wasn't moved, he saw to it personally that Rolando was out of the unit. After he finally was, his health began to improve, and within 4 days, he was discharged from the hospital. While Rolando was lucky, 4-month-old Patrick Zaula was not. He died from sudden cardiac arrest after surgery on his pulmonary artery. This finally put Genene Jones, a suspect, to Dr. Robotham, who had previously backed her. As the investigation moved forward, it came to light that there were 43 patient deaths in the PICU from January 1st, 1981 to March 17th, 1982. 22 of those patients were Genene's. 7 additional deaths occurred in Genene's presence, even though she wasn't the assigned nurse. That makes 29 of the 43 occurrences around her. As a result, the hospital changed its policy for the PICU, requiring all nurses to be licensed as RNs. All LVNs were required to move to different areas of the hospital, except for Genene, who was essentially let go after they, quote unquote, couldn't find a place for her. Though they didn't officially fire her, labeling her as able to be rehired. In the hospital's haste to cover up their own, they destroyed 9,000 pounds of documents. In particular, all documents related to the death of children in Genene's care. Later, this would ruin any chances of prosecution related to those deaths at Bexar Hospital. In the spring of 1982, Dr. Kathleen Holland was getting ready to open a pediatric clinic in Kerrville, Texas. After confirming Genene's previous employment and that she was considered eligible for rehire, Dr. Holland added her to the team. In August, the doors opened to the clinic. The very first day that it opened, on August 24th, 1982, Patty McClellan brought in her daughter, 1-year-old Chelsea. Chelsea had a hyaline membrane disease, which is underdeveloped lungs. The result was a NICU stay at birth and in May before the opening of the pediatric clinic. And Chelsea was brought in the hospital for further respiratory issues. She was sent home, but in August still had some minor respiratory complaints, and her mother brought her in to be seen. While Patty and Dr. Holland were speaking, Genene offered to take Chelsea into another room as she was getting restless. Within minutes of leaving her mother's sight, Chelsea was limp and on oxygen. Genene reported that she simply went unresponsive, and Dr. Holland placed an IV, and Chelsea began seizing. She was given Dilantin and was sent to the hospital in an ambulance. And Chelsea already showed signs of recovery. Still, Chelsea needed to stay in the ICU for a week before being well enough to go home. 3 days later, Nelda Benitez brought in 3-month-old Brandy Benitez as she was passing dark and bloody stools. Dr. Holland recommended Brandy go to the hospital, but gave an order for Genene to start IV fluids as Brandy was at risk for severe dehydration. Dr. Holland left the room to call the hospital for a transfer, returning to find Brandy gray with her hands and feet turning blue. Her breathing was labored, and she was brought to the pediatric ICU where she needed to be intubated. Genene started a second IV line in the child's foot, as the EMTs that arrived didn't have equipment for it, after which Brandy went into cardiac arrest and had to be resuscitated en route to the hospital. On August 30th, 4-month-old Chris Parker was brought in for stridor. Genene viewed the child in the waiting room, reporting cyanosis to his feet, and brought him to an examination room, and from there he was sent to the ER. Genene hovered over him until he was transferred, claiming he was going to code. Later that same day, 7-year-old Jimmy Pearson was brought in because his skin was ashen. He was cyanotic in the limbs and suffered from seizures. He was born with a heart condition, tetralogy phila. Dr. Holland immediately called for a medevac. He was transported to the hospital via helicopter, and Genene went with. While they were airborne, Genene kept saying Jimmy was deteriorating, though monitors suggested otherwise. She listened to him with her stethoscope, which would have been impossible, and then pulled a syringe from her pocket and injected it into his IV line. The paramedic on board told the pilot what was happening and had it recorded that Genene was injecting an unknown substance into Jimmy's line. Right after the injection, there was a rapid shift in his vitals and he went into respiratory distress. Then he coded. Jimmy was intubated, but the tube became dislodged and CPR needed to be performed. Jimmy passed away on October 21st, 1982. On September 3rd, 21-month-old Misty Reichenau was brought in after having a cold for days that progressed into a fever and sores in her mouth. She was stiff and immobile on examination. All of these are signs and symptoms of spinal meningitis. But in order to confirm that, they would need a spinal tap, a procedure that has to be done at the hospital. So they called for routine transport. And during this time, once again, Genene was sent in to place an IV and give fluids. After the IV was placed, Missy stopped moving and went into respiratory distress, then seized. Dr. Holland intubated. Another nurse, Debbie, brought in a bottle of Anatine, a muscle relaxer, to help with intubation as Misty was rigid. But Dr. Holland opted not to use it because it required a dose based on weight and the situation was too urgent to do the calculations. The bottle was set down and conveniently disappeared during the time the transport occurred and the room was cleaned. Once again, by the time she was in the hospital, she began to stabilize. On September 17th, Chelsea went back to the clinic with her brother Cameron for immunizations. Genene injected the first of 2 shots into one of her thighs, and Chelsea immediately seized and had difficulty breathing. According to Petty, Genene forced the second shot into Chelsea's thigh, though Petty was telling her to stop. After the second shot, Chelsea stopped breathing and went limp. Genene packed a bag with more syringes, medications, and other supplies before loading in the ambulance with Chelsea. As they headed to the hospital, Chelsea went into cardiac arrest and flatlined. Genene was to administer epinephrine, calcium chloride, and sodium bicarbonate with compressions. Still, she was pronounced dead at 1:20 p.m. That same day, 5-month-old Jacob Evans was brought in for crying fits. His mother Lydia reported that Genene took him back for blood tests and was told that he needed to be given an IV in case he started seizing. Genene then told Lydia to stay in the waiting room, where she stated she could hear him crying before sudden silence. Then Genene came out and paged Dr. Holland. Dr. Holland was out of the clinic and arrived back as Jacob was put into the ambulance. At the hospital, he was admitted and stayed for 6 days before being released. The number of emergency cases arising from this pediatric clinic caught the attention of Kerrville Medical Management Board, who began to investigate. A committee was formed and they called Dr. Holland to talk to them. A notice was sent out that any future emergencies from the clinic were to be observed and monitored by the staff at Peterson Memorial. That same day the notice went out, on September 23rd, a 5-month-old, Rolinda Ruff, was brought in to Dr. Holland by mother Clarabelle for persistent diarrhea. As Clarabelle was checking her child in, Genene brought Rolinda to the back to check vitals and start an IV for fluid resuscitation. Clarabelle said she could see the IV and then suddenly oxygen being placed and Rolinda gurgling. Rolinda was rushed via ambulance, but accompanied by Genene and Dr. Holland, as per the usual at this time. At Peterson Memorial, Dr. Frank, an anesthesiologist, Dr. Packard, Dr. Adams, Dr. Johnson, and Dr. Merritt were all waiting for them to arrive, to save the child and to watch for any unusual activity on the part of Genene and Dr. Holland. Rolinda appeared to be breathing on her own, but Dr. Holland still intubated, though Dr. Merritt had advised against it. Dr. Bradley was watching Rolinda, who was now making jerky, flailing movements, which he recognized to be a common symptom that occurs as succinylcholine or anatine leaves the system. Dr. Bradley alerted other team members of his suspicions, and in the meantime Genene called and told the receptionist to have Mary Parker, another mother, who brought in her son Chris to the clinic to go to the emergency room. Chris had an ear infection, and when he arrived, Genene started working on him. As she worked on Chris, a hospital nurse told Genene she needed the area for incoming patients, to which Genene purportedly told her that she was worried the baby was going to code over an ear infection. And like clockwork, within minutes of Genene having her hands on him, Chris was a code blue. The hospital staff were able to stabilize him when Dr. Holland entered the room. It was at that time she noted that there was a syringe with fluid in it. None of the hospital nurses knew where it came from, and as a result, Dr. Holland ordered a nurse to simply get rid of it. This incident resulted in Dr. Dwayne Packard taking notice, and he spoke with Dr. Venus, who happened to work at Bexar Hospital at the same time as Genene, and had noted the alarming number of infant and child emergencies and deaths while Genene was employed there. On September 24th, the news of the Bexar cases reached the committee in San Antonio, and Dr. Holland was called to discuss. For her own cases, she had written down all the pertinent medical information and treatments administered, which would have made sense, but the cases of the baby's flatlining did not. The committee then asked her about the use of anatine, which again she denied using. From there, they moved into asking if Dr. Holland knew of the cases in Bexar and why Genene no longer worked there. She stated it was because LVNs were removed from the role in the PICU. Ironically, as they were finishing their meeting, Dr. Holland received a page. Jimmy Pearson was with Genene and was coding again. This was a tipping point. They called the Texas Board of Vocational Nurses and told an investigator, Ferris Aldridge, the situation. Ferris, however, reported that for criminal complaints, law enforcement needed to investigate and subsequently called the Texas Rangers. Dr. Holland spoke with Genene about the meeting, and Genene immediately went into a rant about anatine and how others were making up rumors. But also she found the missing bottle in the trash with the seal popped off, though she claimed that no amount of fluid was missing from the bottle, and there were no puncture marks indicating it was ever used, and so she put it next to the new bottle that had been reordered when the first went missing. The day after their talk, Dr. Holland's colleague, Dr. Packard, let her know that Genene was under investigation. Finally, Dr. Holland was starting to see that there may be something more going on. She went and personally looked at the bottle that was opened, and sure enough, 2 puncture marks on the top. She confronted Genene, reportedly stating, quote, "How the holes get there? How am I going to explain the holes in the bottle?" End quote. To which Genene supposedly replied, quote, "I don't think we should explain them at all. I think we should just throw it out. We thought the bottle was lost. We should say we never found it." End quote. Genene then, in all her wisdom, claimed to have an overdose of doxepin. Dr. Holland found her to have glazed over eyes and found an empty bottle of the medication in her pocket. And so Dr. Holland called an ambulance and Genene was taken to Peterson Memorial, where she had her stomach pumped. Later, they found out she had only taken 4 pills, not the entire bottle. And it was at this time that Dr. Holland had to open up to the committee. Dr. Venus, Dr. Bradley, and Tony Hall went to the clinic where they were shown the bottle of anatine. Then the clinic records were searched, and during which they found receipts for not 2, but 3 bottles of anatine. The 3rd bottle was conveniently missing. At the hospital, Ranger Joe Davis met up with Genene and questioned her about the anatine bottles, as well as the number of emergency occurrences at the clinic. She agreed to take a polygraph, so long as Dr. Holland also agreed. And when Genene was released from the hospital, she attempted to return back to work, but Dr. Holland had had enough. And she informed her that she was let go because of all of the incidents and because of her own psychiatric health. Both Dr. Holland and Genene ended up taking the polygraph, and I know, surprise, surprise, the doctor passed. Genene did not. Joe Davis worked with the hospitals, gathering what information he could. But remember that Bexar covered up most of it in their efforts for self-preservation, making a case hard to land against Genene for all the children there. Still, he gathered what information he could, and by October 4th, 1982, had Ron Sutton, the DA, present the information to the Kerr County grand jury. While he could only go after her for the death of Chelsea McClellan and the injury of 6 other children. Still, as the hearing went on, the media picked up the story of a baby killer nurse, and by February 16th, 1983, of nearly 60 infant and young children harmed at the hands of this woman. One of their key witnesses in this was a woman named Kathy Ferguson, who spent time at the clinic and lived with Genene for a time, and reported seeing Genene draw up clear fluid from a bottle in her top drawer and inject children who would inevitably go into cardiac arrest or stop breathing. On May 7, 1983, Chelsea McClellan was exhumed and tested, confirming she had suffered an overdose of anatine. This means that on May 28, 1983, Genene Jones was finally officially indicted for the murder of Chelsea, as well as the intentional injury of her and of Brandy Benitez, Chris Parker, James Pearson, Misty Reichenau, Jacob Evans, and Rolinda Ruff. Genene went on the lam, however, marrying Garen Ray Turk, a 19-year-old, and absconding to Odessa. She was subsequently found and brought back to face justice. On January 5th, 1984, Genene's trial finally began. It lasted just a month, and on February 5th, after a simple 3 hours, the jury came back with a verdict. Guilty on all counts. At sentencing, Genene was given 99 years with the possibility of parole. Another trial later that year was held for Rolando Santos in October, to which she was again found guilty and sentenced to an additional 60 years with the possibility of parole. Dr. Holland shut down her clinic, but practiced out of her home. Bexar was investigated for its missing files and claimed that they were destroyed during a routine cleanup. They were subsequently fined for obstruction of justice, impeding an investigation, and withholding information pertaining to the case. Genene first came out for parole in 1994. The parents of Chelsea came out swinging, and she was denied. During an October 1998 interview for parole review, she's tearfully told a parole officer, quote, "I really did kill those babies," end quote, and testified Bexar County Assistant District Attorney Jason Goss, who was leading the prosecution on 5 additional murder charges. On another occasion, Goss told the court a fellow inmate wrote the parole board opposing her release, explaining that Genene had told her, quote, "I didn't kill those babies, the voices in my head did," end quote. The same occurred in 2009. Chelsea's parents came out and she was denied. But then the Texas mandatory release law came out, and it stated that if a violent crime occurred between 1977 and 1987 and the criminal had served at least 1/3 of their time, they would be released as part of population control, meaning Genene was expected to be released in 2018. Oh, the result of this was an uproar and petitions went out. Outreach programs were created to keep her in. And then, as a surprise, on May 25th, 2017, Genene was brought up on charges for the murder of 11-month-old Joshua Sawyer. In June, the death of Rosemary Vegas was added to her charges, and 2 more were added to the list in January of 2020. She ended up pleading guilty for the murder of Joshua Sawyer, in which she received a life sentence, but the other cases were dropped. Joshua's mother, Connie Weeks, said of this, quote, "I hope for you to live a long and miserable life behind bars. Goodbye," end quote. Quote, "With this plea, the odds are she will take her last breath in prison," end quote, said Catherine Babbitt, Chief of Major Crimes for Bexar County District Attorney's Office, after the hearing in San Antonio. Technically, Genene will be eligible for parole in 2037. And that is the horrible case of another nurse who had Munchausen by proxy and killed a bunch of children. With that, to all those out there listening, be careful. It's a dangerous world we live in.